So smell serves a number of different functions. Like one is it warns us of potential hazards, like household gases or potential toxic agents or rotten foods. Then there's a second dimension that's a social dimension. So we communicate through odors. So it's also mediate, for instance, when an infection is coming up, my body odor would change and my people around me would notice that and they would keep distance to me probably. Or also like, for instance, in female tears, there's a signal that affects our male libido. And the a final dimension would be eating and drinking. So if you lose a sense of smell, it is like if your nose is no longer there. And so what is left of eating and drinking, it's the basic tastes. It's like sweet, sour, salty, bitter, umami. And you have the hot spiciness of the food, you have the texture, but all the fine fragrance, the flavor, it's all gone. The consequences of that, or maybe independent of that, it's sort of a matter of debate, people also would develop depression. Not all of the patients, but some of the patients who visit our clinic, like 2/3 of them are showing signs of minor depression. Of course, not everybody with smell loss comes to our clinic, so they can also be qualified. But depression is always there when people lose the sense of smell. And when it improves again, then actually depression also, or these depressive signs also would go away. It's not a major depression, but it's depressive signs, one has to put it that way.
It's very variable. So some people really suffer the hell of losing sense of smell, whereas others barely perceive it. So we have the whole variety of possible reactions to that. So I'm probably biased as a physician. I have running an outpatient clinic for smell and taste disorders. So I'm confronted to mainly patients who complain of that. And in these patients, there are also varying complaints, is from simple non-detection of burnt things in household, accident, things like that, ranging from not smelling my partner, my child, or being depressed because food is not the same pleasure anymore. So, as I said, there are other people losing sense of smell where this is hardly ever recognized. We feel that this is also related to how quick this loss is. You know, if you gradually lose sense of smell over time, let's say over a 10-year period, you maybe this goes unnoticed. Whereas if you all of a sudden lose sense of smell after a blow or an accident or a viral flu, then you will realize it much quicker. Now, how can we treat it? Nature is sometimes indulgent and gives us back, like what we call spontaneous recovery. So there is an intrinsic possibility of this function to recover by itself. However, it often depends what is the cause of the sense of smell loss. So if it is just a purely nasal problem, like you have a stiff nose, blocked nose, polyps, then treating the underlying nasal condition often helps the sense of smell. If it is, for instance, a head trauma, then it's more difficult. There are not yet so many treatments out there. One very promising is what we call smell training. So people are actively asked to expose themselves to odorants and focus on this activity. And there is growing evidence that this has a positive impact. But there is a lot of work to do, of course, in this field.